ICU syndrome, or is most commonly called delirium. Acute delirium is the more appropriate term in medical literature. So that means basically a person who is stayed in ICU for long or under serious medical conditions start developing some agitation, anxiety, restlessness, which may interfere in his treatment and may impede his quality of recovery and eventually outcomes in the hospital. It is a very common phenomenon which we are observing, and it is more common we see encounter in elderly patients, patients who have some underlying neurological disorders, like they have underlying stroke, they have underlying dementia, they have underlying some other chronic medical diseases like renal failure, cancer, etc. So these are the patients who are very prone to develop delirium, acute delirium in ICUs. Mostly people who are either alcoholics or drug abusers, because that is not there in the hospital. So withdrawal of those medications also precipitate the acute delirium. And the elderly people are more prone and more susceptible to develop this problem in intensive care units. So the most common symptoms we see there are either positive. Either positive means I would say uh, aggressive symptoms, or negative symptoms, or both can occur. So aggressive symptoms, what I mean is acute agitation, uh, fluctuation of level of consciousness. Sometimes we encounter that the person is oriented, conscious, talking, and then after a few hours, when the patient relatives come to visit in the ICU, they say that he's very drowsy, sleepy, not waking up. Sometimes you see they're talking irrelevantly, confusion, they are taking out all their central lines, endotracheal tubes. So, and agitation. So these are the very common symptoms which we see in acute delirium patients. Also, sometimes the patient gets into depression. Sometimes that's also seen. 20% gets into depression. They are hardly talking. They are very sleepy, not responsive at all. So that type of subset is also seen in ICUs. So, as I said, these patients are already on the edge, and any major um, stimulus can lead to the precipitation of these symptoms. So, stimulus, I mean, like patient drugs are the fourth foremost common cause of these delirium. Like patients are on certain sedatives, they're on certain seizure medications, certain antibiotics. So, various medications can precipitate that. Second most important factor is the loss of exposure to sunlight, because ICUs are all closed. There is no exposure to sunlight. It's an alien environment for them. No relatives are there at the bedside. So they get confused and agitated. And third, obviously, the inherent disease, which leads to these problems, and the long stay, alarms and ringing, and foreign medications, different people whom they have not met earlier. So all these lead to acute confusion and restlessness. So these patients are actually if they're very critical, the ideal base scenario is that they should be moved out of the intensive care units as early as possible in a more friendly environment, so that the relatives can stay with the patient continuously, reduce the medications which cause these problems, exposure to sunlight, open air. But sometimes it is not possible in hospital scenarios. So we try to do all these things. But then, yes, we are not always successful, and they develop sometimes severe delirium in intensive care units. So this is the problem we encounter commonly. So many hospitals are now focusing on this, and it has become a very important talking point, especially in Western world. Unfortunately, in Indian cases, the burden of patients is so much that sometimes that is overlooked. But yes, we have counselors and psychologists available. And the important thing is empowering the relatives of the patient. They can stay more frequently in the intensive care units, shifting them out, or well-lighted intensive ICUs with the windows and exposure to sunlight, or moving them out. So these are the various things which we employ in our as a part of the treatment protocols to help to reduce the delirium in these patients. Yeah, yeah, you are very right in that part. I would say that yes, mental health is still yes now a topic of discussion, but probably it was not so much like 5 years back, and still we don't have very robust guidelines and protocols to manage or identify these patients. So overall, I would say mental health, like patients of depression, anxiety, the prevalence, if you see the data, the medical data is very high, almost 20%. If you see the Western data in India, yes, we are now seeing it and recognizing that. So the stigma is still there, but probably now people are ready to accept that yes, it's a problem. It has its solutions, and one should consult a proper medical personnel to get its treatment. So things are changing, but yes, it will take time for the things to change in the long term.